Hey guys, what's up? I am Jen Rosenbaum, breast cancer survivor, author, as of recently, and portrait photographer. And today is July 6th, 2020. And I wanted to, in all honesty, this is a Facebook Live, which all of you know who are watching this live right now. But I'm also going to be posting this on YouTube after. So if you're watching it on YouTube, this is being done live, and I'm doing it this way because I'm sort of returning to my roots here. I'm just going to look at the comments. I'm sort of returning to my roots. Back in 2017, when I was diagnosed with invasive lobular carcinoma, I announced it live on Facebook, and it became one of my most watched videos, and it's now lives on YouTube as well. And for a while I was just putting videos on YouTube, but I decided today to do a live because it's been a long time, and I'm getting a lot of questions lately. And for all of you that are here, hi, thank you for joining me. And this is just a crazy month. July is a crazy month. July 10th is the anniversary of when I went in for my mammography. July 12th is my anniversary of diagnosis. So there's a lot of stuff going on this month, a lot of emotions, and thank you. Somebody just said, we missed you. Thank you for saying you missed me. I have sort of laid off the videos a little bit just because everything with COVID, I really kind of wanted to have some respect for all of that and all of that medical stuff that was going on. So I sort of laid back a little bit, but I'm ready to hop back in, and there's a couple of reasons why. Number one, yes, I did write a book, and it's called What the F Just Happened, A Survivor's Guide to Life After Breast Cancer. That is what I spent a lot of my time in quarantine on, but I wrote the book because there's so much that goes on after treatment that is not talked about, at least in my opinion. And I didn't really have any good references when I was done with treatment and I started getting back into life, and I found it to be really, really, really difficult, and some days still do. I wanted to write a book about it. So that's the first reason why I'm coming back, and I really want to get that book out there. And it's coming out on Amazon Kindle Thursday, but I'm offering free copies to breast cancer survivors. So if you are one of them, you can contact me by email. At the end of the week, I will have a page. You can just put your email in and you can get the book, but we're not there just yet. But I just wanted to kind of put it out there. And one of the reasons that I put it out there, and one of the reasons I wrote the book, and one of the reasons I'm doing the video today is because I am having surgery on Wednesday, and I've mentioned it here and there, mostly on Instagram. I've been a little more quiet about the surgery this time around, and I will explain why. And if you guys have any questions, I can see your comments. And if you have the question, somebody else probably does. And as you guys know, I'm a total open book, so please feel free to ask your question, no matter how personal it might be. I'm happy to answer questions about this. I think nobody really talks about it, and I really want to get it out there. Okay, so I had a mastectomy a bilateral mastectomy in August 2017. I had my first reconstruction March 2018. It did not look good. I was under the muscle, and I looked like I had 2 hamburger buns. It was just ridiculous looking. So I had another reconstruction done in November 2019, which isn't even that long ago, where they moved the implants over the muscle, and they tried to build sort of a support system to hold the implants in place because they were not in the right spot. That didn't work either. And, sometimes we don't know for a number of months. When you first have the surgery, you're swollen, everything is where it should be, it looks great. And then over time, as things settle and heal, it takes some time, some months to know really where you're going to end up. So for me, my breasts did not end up in the right place. They are still totally uneven. I have really terrible rippling on the top. I did a fat grafting, none of it stuck. So it just looks really, really, really off. And it's really difficult. It's one of the things that is so hard about being a survivor. This inner conflict of should I just be happy I'm alive, or should I care what I look like? Or both, or neither, or, there's so much that goes on. So what happens is, these surgeries, these reconstruction surgeries, are a really big deal. They're really exhausting. And after this last one, I said, if I ever want to do this again, somebody please shoot me. I should not do this again because it's uncomfortable, it's painful. It doesn't just affect your chest, it affects your back, it affects where you're having fat grafting, it's liposuction, you're sore, you're tired, you can't work out, you don't eat right, you feel fat, you know, there's all these things that happen. Mentally, you're like, I'm losing my mind. So I said after my last one, I'll never do this again. And that goes to show how bad it looks because I'm ready to do it again. So here's the problem when I tell people that I'm having the surgery and why I kept it a little bit quiet this time, because people's reaction is usually this: well, it looks good enough to me. You look good to me. Now, this is one of the things I talk about in the book, actually, where people say things that come from a place of love but are actually really hurtful. And for those of you who are saying, oh, you look beautiful, you look great, thank you. I appreciate that. I know that you're saying this to me from a place of love. But what happens is when you say to somebody, well, it looks good enough to me, you're devaluing their feelings about it. It's even a little bit borderline shaming them for feeling the way they feel. I mean, even sometimes people say to me, is it worth the risk to keep having surgery? Aren't you tired? Yeah, I'm tired. I am so tired. I am so anxious about this surgery beyond you can't even imagine. This is like giving birth to your third child. You already know what labor feels like. It's awful, right? It's like, I don't want to do it again. I don't want to do it again, but I also, you know what else is hard and painful and annoying is looking in the mirror every day and seeing deformities. Looking in the mirror every day and going, what am I going to wear today to hide this disaster? And now listen, I'm not afraid of scars. I have a lot of scars. I'm totally okay with showing them. I'm proud of them, and I really believe that they are a badge of honor for me. But it's not about the scars. It's about the rippling. It's about how low they are. It's about looking flat-chested. It's about not having cleavage. It's about not feeling feminine at times. It's about not feeling whole and not recognizing what you see in the mirror. And so for all of those reasons, I'm still fairly young. Some of you out there might disagree. You know who you are. But I'm still fairly young. And I still believe that I am young enough, and you're really young enough at any age, to feel good about your body and to be able to look in the mirror and say, okay, they might not be my breasts, but they're as close as they can be, and I feel somewhat normal when I put on clothes. Getting dressed every day is a chore, every day. You know, occasions like finding a bathing suit, forget about it. I have a whole video just based on finding a bathing suit as a breast cancer survivor, or finding a fancy dress for an occasion, or wearing a tank top, or even finding a bra that's comfortable and flattering. It's very difficult, and it's these little things are constant reminders where you might look at me and say, well, it looks good enough. She looks good enough. They pass for real boobs. Yeah, they pass. It's fine. You know, they're fine. They're good enough. But it brings up more than just, oh, what does my body look like? It brings up a constant reminder of cancer. It brings up, again, the attack on the femininity. And it's very, very difficult to escape that. And as cancer survivors, we want to escape that sometimes. We want sometimes to not be reminded of cancer every minute of every day and feel good and feel human and feel feminine and feel sexy, for God's sake. I mean, there's nothing wrong with, you know, breast cancer survivors, or any woman for that matter, wanting to feel sexy. You know, we are ripped of our hormones often. We're ripped of our lady parts. We're sometimes ripped of our hair, and we want to feel good. And, you know, there are some women that can't have reconstruction, and that's really difficult also. So I'm very grateful that I have the opportunity for reconstruction. And that is why I'm doing it for the third time. Am I scared? Yeah, I'm terrified, because I'll tell you this. I found an amazing surgeon, and I'll answer your question in a minute. Somebody asked if I had the same surgeon each time. I have not, and I will get into that. I'm terrified because I know this is the right surgeon, and if he can't do it, nobody can. So we're going to see how this goes. That's my biggest fear in the whole thing, besides just the pain and the aggravation of going through it again, because I know that that's temporary and that will pass. I do hope that this is it. And no, I'm not using the same surgeon. And so let me talk about that a little bit, because one of the questions I get a lot is, what do you wish that you knew when you were first going into this? And one of the things that happens is when you're diagnosed with cancer and all of a sudden you're faced with you need a mastectomy and reconstruction, and you make these decisions, or at least I did fairly quickly, and I really didn't do as much research as I wish I had done, because you're just in survival mode and you're just doing what the doctors tell you to do. This is what they think is best, so you just do what they think is best. I know some people do a lot of research. I'm not one of those people. I'm one of those do and ask questions later, unfortunately. So I probably didn't do as much research as I thought, but I figured, okay, what's the big deal? I'm going to have them taken out, they're going to put new ones in, and it's going to be great. And even going into, making the decision of having a mastectomy and reconstruction, I just thought, what's going to go wrong? You put implants in and they're going to look great. I'm going to look like I have 20-year-old boobs. That's awesome. It just doesn't work like that. So, okay, so basically I said, okay, let's just go. We're just going to go straight to implant. It'll be fine. Or straight to reconstruction. So I did. I had my mastectomy. They put in expanders. Once the expanders made enough room for implants, we put the implants in. Now, I didn't really ask. I didn't know that there were different density implants. I didn't know there were different profile implants. I trusted the doctors, and I said, just do what you think is best. And I do believe that they have done what they thought was best. I never, like, people say to me all the time, well, what are you going to do about these two surgeons that didn't do what you thought they were going to do? I don't blame them. I don't think that this is their fault. I think that they did as much as they could possibly do and what they thought was right. It just wasn't right for my body. And there's some things that contribute to that. Maybe they're just form of habit. They like to use a certain implant all the time, or maybe they're overrun with cases and they just kind of, make decisions a little quicker than I wish that they would have. I don't know, but I'm certainly not pointing my finger at them. I do believe that they did what was right. My problem with them was that when I expressed my displeasure with what I looked like, I got, it's good enough, just be happy you're alive. And that to me was not okay. And that is when I knew I had the wrong surgeon. So things I wish I knew prior to having reconstruction. One, I wish I knew that there were different implants. I wish I knew that there was different profile, different density. I wish I knew that over the muscle feels very different than under the muscle. And I'm not saying one is right or one is wrong. For me, over the muscle is much more comfortable. However, there's a lot more rippling because there's nothing covering the implant. It's just implant. So I wish I would have been told that there would probably be a lot more rippling. I wish I would have been told that there's a different density implant so that maybe that would prevent the rippling. I have very thin skin on my chest because my mastectomy went all the way up. Sometimes they just take the tissue out till about here. Mine went all the way up. So I have very thin skin. I'm skin and bones here, an implant, and that's it. So you can see every little move that the implant makes. It's not cute. So I wish I would have had that discussion. I wish I just would have asked why a lot more. I wish I would have asked my surgeon, why do you prefer over the muscle? Why do you prefer under the muscle? How do you make sure we don't have rippling? How do you, what am I going to feel like? Is it going to be constant pain? Am I going to be able to do a push-up again? Because by the way, I still struggle with push-ups, mostly because my pectoral muscles have been cut and resewn, and it's just kind of a mess. I wish I really would have known. You know what I really wish somebody would have told me? Let's even go back to basics. I wish that maybe even my plastic surgeon would have said to me, there's a good chance that we're not going to get this right on the first shot, maybe even the second shot, maybe even the third shot. The more and more that I talk to women, the more I see that it often takes 2, 3, 4, 5, sometimes up to 9, I've heard, surgeries to get breasts to look passable as normal. And I wish I would have known that. I didn't know that. I didn't even know that. I mean, I just assumed on my second surgery, like, okay, they made a mistake. They're going to fix it now. I didn't realize that I would be having a third surgery. Like, that thought didn't even cross my mind. So I wish somebody would have said that to me. And I guess I want to put that out there to you if you're a breast cancer survivor and you're thinking about reconstruction, or you're thinking about surgeries, or is it right for you or not. There is a good chance that this will require more than one surgery. And I've had a major surgery every single year since 2017, and I'm not done. I am going to have my ovaries removed at some point. I'm probably going to need another fat grafting after this just to make sure everything is right. It's exhausting. And so when people say, why are you doing this again? What are you thinking? It looks good enough. You have a family. Why are you putting yourself through this? Is it worth it? Yeah, it's worth it. It is worth it. If it comes out looking good, it is worth it, because this is far beyond aesthetics. This is emotional. It's self-esteem. It's survivorship. Survivorship. Is that the right word? It's survivorship. It's really quality of life is really what it is. It's emotional. I'm not going to say it has nothing to do with what I look like. Of course it has something to do with what I look like, but it's far more emotional than it is aesthetic. And although it may look good to you and you're giving somebody a compliment, like I said, when you say, well, it looks good enough to me, yeah, I could pass it. I could pass it off, no problem. I've learned that, but it's a job. It's exhausting. It's not fun, and it's defeating. I mean, how many women out there? How many of you who never even had breast cancer like bathing suit shopping? Guarantee nobody does. How many out there really like clothes shopping? Guaranteed. Oops, sorry, nobody does. It's difficult, and this makes it even harder. And it can often just sit in your stomach, in that pit of your stomach. I went to the beach last week, and I hate that I do this, and I talk about it in the book a little bit. The beach was pretty crowded. Don't worry, I had a mask on. The beach was pretty crowded, but I find that at times I desperately search for somebody like me. I can wear a bathing suit and I'll pretend like all is okay. And if somebody sees my chest and they think it's weird, it's really their problem, not my problem. I'm going to enjoy myself, period. But I have moments where I scan the crowd and look for somebody like me. Now, I realize that here in New York, about 1 in 7 women have breast cancer, or get breast cancer at some point in their life. So there's guaranteed other people at the beach that have had breast cancer. They might not have all had a mastectomy, so it'd be hard to tell if they even had breast cancer. And I realize that. Or they might have great reconstruction and I would never know if they had breast cancer or not. But I desperately search at times for somebody like me. Is there somebody like me out there? I know there is, because I know these women, but in the moment, you just want to feel normal. You want to feel included. You want to feel like you're not a freak or deformed, and I can't find anybody that looks like me. And it's probably because women that do have a lot of the same problems I have probably cover up. They're shy about it. They don't want to show it. I have those moments as well. But it's very difficult. It's very difficult on the psyche when you don't see people that look like you. And that's just human nature, It doesn't make me feel bad about myself per se. It doesn't affect my self-worth, but does it affect my self-esteem? Yeah, sometimes it does. And so therefore, I just think it's really important to explore reconstruction at least one more time and see what happens. All right, we have some questions. Yes, why can be a very powerful word. I really agree with that. Why? And here's another thing. If your plastic surgeon is afraid to spend more than 5 minutes with you to answer those questions, find yourself a new doctor. Trust me on that, okay? My current plastic surgeon spends so much time with me. I think he's sick of me. But he never says to me, I don't have any more time for questions. He will say, I have another patient. I'll be back in 10 minutes. If you can wait, I'll answer all your questions. I hear your concerns. He's really amazing. It's a whole different experience. And so I'm hoping that that's going to help me get better results. Okay, Sherry asks, how long do you suggest you live with them before knowing you're not happy with them? She said she's a month out and she's not sure when she'll feel okay. Sherry, it takes at least 4 to 5 months, I would say, maybe even 6, to really know where they're going to settle, what it looks like. Again, I'm not a doctor. Please don't take any medical advice from me whatsoever. But I will tell you that November, December, January, February, March, April, May, June. I'm exactly 8 months out from my other surgery. And I booked this surgery probably in January. So, or February maybe. So I was only a few months out, but I just knew it wasn't right based on my past experiences. It was about 3-4 months and I knew it wasn't right. So, this surgery was booked quite a while ago and it got even worse. So I'm very glad that I'm going to be going in and doing that. Sherry says, I'm kind of obsessed with seeing other women's to compare mine to theirs. So here's what's funny. I have this joke. It's not perfected yet, but hear me out. I have this joke. How do you know there's two breast cancer survivors in the room? You know, because they've shown each other their boobs. I mean, it's like constant, like, oh, you want to see mine? You want to feel them? You want to hold them? I mean, because they're accessories to us, right? It's not weird for us to show our breasts to each other because they don't really feel like ours. At least that's how I feel about it. I post pictures of mine for this reason, because I think also one of the things I wish I knew was that a lot of doctors show before and afters that are amazing and not always typical of what we get. So what I used to see on the internet was either amazing breasts that I was like, wow, is that what my breasts are going to look like? I'm in, sign me up, you know? Or totally deformed nightmare cases, which scared the living daylights out of me. So, you know, I think that we have to be careful. We have to manage our expectations, and we have to know there's a lot of possibilities of what can happen, good, bad, and otherwise. You know, yes, I'm afraid. Yes, I'm scared of infection. I'm scared of my body rejecting implants. I'm scared of all the things, but I'll just take it as it comes, you know? So I would say give yourself, especially if it's your first roundabout, Sherry, I would say give yourself at least 4 to 6 months and see how you feel after that. Also, because I find that even though the recovery from the surgery is about 4 to 8 weeks, I would say at 4 weeks, I really started doing some more stuff like going to the gym and doing some things. 8 weeks, I started feeling a little bit more normal. I personally think it takes 6 to 12 months to really start feeling 100% yourself. Like I'm at 8 months from my last surgery, and I just started sleeping on my stomach this week, which is why it's so annoying that I'm going back in for surgery again, because I'm finally just feeling like I can really work out. I have the energy, and I'm feeling my groove back a little bit after 8 months. So it takes time to heal. So give yourself that time, Sherry, before you just decide that you don't like it. Give yourself some time. And truthfully, you don't want to have surgery that soon after. It's too early and you'll just knock yourself out, and you don't want to do that. So somebody says they never tell you what to expect after. Yeah, they don't. You know why they don't tell you a lot of times? Well, first of all, I find that most plastic surgeons, not all, most plastic surgeons, and all of my plastic surgeons, I'm on my third, have been men. Innately, that's an issue, okay? Because they don't know what breasts feel like to begin with. Forget what it's going to feel like after. So I always say, if you want a medical answer, ask the doctor. If you want the real answer, ask the patient. So that's partly why I do these videos, Lori, because, oh no, who said that? Barbara, sorry. Because I want people to know that it's okay to feel the way you feel, and that many people do. You saw Dr. Dubrow. I love him. Real Housewives fan here. Yeah, it's hard. Listen, there's no, Erin just said, were any of your surgeons women? I'll tell you what, my breast surgeon was a woman. She's the one who told me I might not feel hugs, if you guys remember that. And I went back after, and I love my breast surgeon. Love. Like I would have dinner with her. I love her so much. Like she's amazing. We spend like an hour together every time I go in to see her. I love her. But I said to her, you're not really right about that. And you should have probably asked some people before you go around telling people that they're not going to feel hugs anymore. The truth of the matter is everybody's a little bit different. I feel a lot of pressure sensitivity. So if somebody's touching me, like if someone's touching me very gently, I don't feel it. But if you put pressure on me, I do feel it. So when I hug somebody, of course I feel it. But this feeling of, like I've explained this before, of like always wearing a bra, like your bra's always on. Ladies, that feeling when you get home and you take off your bra and you're like, oh, it's the best feeling. If you're a breast cancer survivor who had a mastectomy or a BRCA, you had a prophylactic mastectomy, whatever. If you had a mastectomy and you had reconstruction and you want that feeling of taking off your bra, you'll never have it. Right now, as we speak, I am not wearing a bra and it feels like I am. And not only that, it feels like the bra is 2 sizes too small. And that's a constant, always feeling like that. I know some of you here had the same, so let me know if you feel the same way. Linda said, I'm offended you never asked me to see my boobs. Well, that's because we're usually in public, Linda. And, but I mean, if you want, go for it. I've done it. But yeah, it's, for me, it was really about like seeing, people's breasts before I had my full reconstruction. Like when I had my expanders and like one boob was here and the other boob was here, other people showed me their surgeries and I was like, oh, thank God, it's going to go back to normal. And that is one of the things I'm going to be doing, is I promise, I keep saying I'm going to do it, but I promise I'm going to do it. Making a video of all the progress through the mastectomy all the way up to this surgery, because I think that that's really important. Okay, let me just make sure I'm answering all the questions here. Yeah, Linda said, I was completely unhappy with my plastic surgery until about 6 months when they fully settled. Yeah, you need time. This takes time, guys. Our bodies are not like, you know, oh, I got new boobs. Great. Here we go. This is not a boob job. I keep saying that. This is not a boob job. You don't go in and get implants in your real boobs and then walk out feeling like, you know, Pamela Anderson. This is not a boob job. This is much more difficult. I don't think I'm changing the brand of my implants. I think I'm just going with a denser implant, Jamie. I want to confirm that with my doctor before I tell you, but I'm pretty sure we're going with the Neutrel, which is what I have now. And I am happy with them, except that they're just not the right density for me. But they're very comfortable. Yeah, so Irina says, I think the number of surgeries you have doesn't matter if you're getting closer to how you feel like you want to feel, which is so true. Yeah, Zoe, I have watched Botched. Now, here's the thing. She asked if I watched Botched. Okay, my unsuccessful reconstructions are not necessarily botched, if that makes sense. This is what I'm trying to explain to you guys. Not every surgery is exactly the same. Not everybody's body reacts the same way. Some people have more drastic mastectomies than others. Some people have more skin than others. Some people have nipple sparing. Some people don't. Some people have incisions under here. Some people have incisions here. Some people go in on the side. So, you know, everybody is a little bit different. And so what they're doing is they are making their best guess. Everything they do in cancer treatment and reconstruction is based on their best guess. The treatment I had is not 100% guarantee you're cured of cancer. This is our best guess of what we can give you that will keep you cancer free. But it's just that, it's a guess. So, you know, it's not, there's no guarantee. I don't know what to tell you. This isn't a nose job. It's not a boob job. This isn't like, you know, just go in and suck out a little fat and I know what it'll look like after. This is so individual based on body. And let me explain that also. So like this part, it's hard to tell because I'm wearing black, but you know, New Yorker. This part here where your breast and your body meet, there's a shelf there, right? Mine is shot. So structurally speaking, no matter what implant they put in, they would fall, okay? My implants are supposed to be here. Let me see if I can push it up. My implants are supposed to be here. Look at how low they go. They just fall, okay? So my implants are pretty far off, inches off of where they should be. So they have to reconstruct this shelf completely. Not everybody has that problem. I have that problem for some reason. I don't know why. So, I need a little bit of a different surgery than somebody else might. This surgery is a different surgery than I had last time or the time before. It just involves different procedures. There's so many different ways. And by the way, you guys, this is a continuing and improving art form. There is no, this isn't like the end. Like tomorrow or Wednesday, sorry, when I have my surgery, my doctor might be like, you know what, let's try this. We've never tried this before. Let's try this. Maybe this will work. And now he has a new technique, you know. This is something that is continuously being learned and changed. Same as cancer treatment. Every time I have a moment where I think, oh my God, what if my cancer comes back? I have to remind myself that in 10 years, 15 years, 20 years, 50 years, they're going to have different advancements than they have now. So, you know, different treatments, different research, different methods. So, you know, when I first had my reconstruction, they were going to put the gummy bear implants in that were teardrop shaped. Now they don't even use those anymore because there's a theory that those cause cancer. They've been linked to cancer. So now all the women that had teardrop shaped implants put in, there was a recall and they had a choice whether to take them out or not. Okay, so if I had implants put in, you know, 4 months earlier, I would have had something different. I would have had to have had another surgery. So this isn't the end, you guys. This isn't like, that's the other thing. This isn't like, okay, let's reconstruct your breast and then you're done. This is, you're done for now. We have to get checked every few years to make sure the implants aren't broken, leaking, problematic. And, you know, breast implants don't last forever either. So I'm sure I need to be realistic about the fact that this is probably not my last surgery, even if it goes well. So Hopefully there's not another one for a really long time, but I don't know when that will be. Zoe said implants are so dangerous. Generally speaking, they're not. Okay, and I really want to, that's one of those comments that we have to be really careful about, because it's not actually true. You know, we have, especially if you're a child of the 80s, we have this whole thought that like silicone implants are so dangerous and they cause cancer. It's actually not been proven. It's been proven otherwise, that they are not dangerous. What happened with the gummy bear implants that were teardrop shaped was there's a texture on them. Mine are smooth. They're round and smooth. The ones that were teardrop shaped had a texture on them. And there's something about that texture that's causing cancer. So yes, I get a lot of emails, you guys, about like implant sickness and all of that. I talk about this in the book. Please be really careful what you say to people that are survivors and are just trying to feel normal, because we have enough to worry about. We have very severe PTSD from everything that we've been through. And, you know, we are often taught things, or we hear things that aren't always the truth. I've done a lot of research about implants and talked to a lot of doctors about it. Silicone implants are, as of right now, generally speaking, safe. Okay, so a lot of the things that we thought about them back in the 80s, 90s, not true right now. That could change tomorrow, but I just want to kind of put that out there. If you guys have any other questions, let me know. Otherwise, I'm going to wrap it up. I try not to keep these videos too long so that they're digestible, and I've already been on a half an hour, which is amazing. I could talk to nobody for half an hour, but it could be because I have a lot of nerves and anxiety right now. There's a lot of nervousness around this surgery. Yeah, okay, so Lori said the texture causes scar tissue. They think that's the link to breast cancer. It's not actually a breast cancer that you get from the textured implants. It's a different type of cancer. I don't know the name of it off the top of my head, but regardless, I know Sloan stopped using the implants. I know they recalled them. So if you have them, might be worth talking to your doctor about. I don't know. Again, I'm not a doctor. Please don't ever take medical advice from me or my videos, because I'm not a doctor. I only know what I know. I only know my experience. And that is where I'm at. I'm sure I'm forgetting to tell you guys some things. I lay in bed at night and go, this is the message I want to get out there. And when I'm on camera, I sometimes forget. But if so, I will add it. And I will start sharing my photos. I think, you know, I've resisted sharing photos of myself with, you know, right after my mastectomy and with expanders, because it's a little frightening looking, to be honest with you, and crazy. But I think it's really important for people to see. And those photos will go in my book. If you buy the printed book, they will be in the book. Sherry, no, it's not weird at all. I am going to make a video. So she said, can we see all 3 of your procedures to see the differences? 100%. I will show it. I have no qualms. If it wasn't for Facebook, I would show you right now, because I am totally not scared. They don't feel like my breasts at all. So I'm not scared, but I will make a video about it and share those images. I want to make sure if people don't want to see it, they have the opportunity not to see it. So it will come with some warnings. But yeah, I don't blame you for wanting to see it, and I'm happy to show it, because I wish somebody would have showed it to me. I really wish I would have found somebody that said, this is the reality here, kid, you know? So I'm just talking to you guys about the reality. Thank you for the positive vibes, everybody, for the surgery. I will keep you guys updated for sure, as I always do. Robin said nobody tells you the implants feel heavy. Yeah, right, they do. They feel heavy. I find that also I'm kind of like hunching over all the time. I'm like, these things are heavy. I gotta, like, you know, straighten out my back a little bit. This whole thing from mastectomy to surgeries has killed my back, for sure. Irina, I really don't want to see anything about implant poisoning right now, but thank you for offering. I'm just trying to stay positive over here. We're not going to have that problem. So I'm just putting the good vibes out into the universe. I do realize it's a thing, but I do not want it to be a thing for me. So that's it. Yeah, and Tanya said she's getting silicone implants next week. I have not had any problems with my actual implants. My implants have been great. My body's been loving them. It's all good. So I just hope that that continues, and I hope that continues for you too. Thank you guys. Thank you for watching. Please share this with somebody that you might know that's a breast cancer survivor or going through treatment or whatnot that has questions. I will be posting a link where everybody can get my book for free if you want it. If you want to pay for it, you can have it on Amazon. But I really just want to get it into as many survivors' hands as possible to try to help them. It is a journey that I am still going through. I wrote the book out of solidarity, not out of superiority, because life after cancer is crazy. I love you guys. Thank you for joining. If you're watching on YouTube, please make sure you subscribe. Down below, leave a comment. I like to answer all of my comments personally. And I just appreciate you watching. All right, you guys, have a great day. All good things, and I will be in touch.